Welcome, K-implant endoprothetics. We want to talk a little bit about different stem options. Why are so many stems on the market? What are the differences? So first we have cemented stems. Cemented stems are available in different options, normally made from cobalt, chromium or steel. They are fixed with cement and have the additional option to be used with gentamicin or antibiotics in the bone cement, which is a nice option. The problem is for younger patients you have the revision problem and you have to think about the geometry more than you have to do it maybe with cemented stems. We have different types available. This is just an example from classical Sputono type for straight stem up to coxafit short or medium stem and the femoral neck system. Where are the differences? So actually all stems are made from titanium alloy, which is able to provide good ingrowth in the bone. We have some types available with additional coating with pure titanium, which is rough and improves the ingrowth more than a standard surface. On some surfaces you have these fins, which give additional stability, and this range has, all the stems have their advantages and disadvantages. Actually very classical here, you see the Sputono type, you see a quite big volume, so you have some part of the bone is used. You have here a straight area, which is very nice for the stability against rotation, the rotational force, because when you have to consider the patient when he stands up from seating, you have here all the load and just this short area will resist against rotation. So actually those stems with this shape are nice against the rotational forces. There are more round stems types like this, and they are more having problems against this rotation. So you have to decide from type to type. Of course, we have types like Coral type 2 with good results. So one idea is to save bone. This means that the surface, the volume is not so big and it's short. So actually this coxafit stem, it is a medium length stem, it's a long short stem or a short long stem. You can do revision of a coxafit with the Sputono, which is actually very nice because we have a surface which is rough, but the volume we remove from bone is not so big, but we have a very high rotational stability because of this shape, and you see the Sputono is bigger in all dimensions, so you can do revision of this stem with this stem. For very young people with some certain problems, it might be a good idea to use the Spiron stem. The Spiron stem in comparison to the other stems is much shorter, so you save here like 3-4 centimeters of bone, which is a very stable bone area, and you do not touch all this area, and you know from long-term follow-up of stems, you have definitely after implantation a bone change. So you have sometimes trouble of having good bone quality for the next operation. There are side effects, and you see this very often on X-ray that over the years the bone change is not perfect. Coming back to the coxafit, it was developed under inspiration of a very famous standard stem, but there are some differences. So here it is not 100% straight, it is a little curved, but only 2 millimeters. And only in the upper area. You don't really see so much. It's shorter. We have distally a little smaller, that we have 100% seating in the proximal area. We have a bigger hole, which gives a good stability of the instrument. And when you see here, this area is not flat, it's a little bit under angle, so we have a better range of motion. The range of motion is much higher than in the ISO standard needed. We have much higher. Ask for more information about it. It's because of the position of the cone, which has a nice offset. Yeah, this is just the overview about some short and standard stems. We have another full program of revision stems, of Corai type, of Miller type, cemented, uncemented, coated, allergic versions, and so on. Please ask for further details. We cover the range even up to a total femur, and we would appreciate to assist you with more information.